Before I started working with Dr. Tom, we were assessing people with chronic illness, working with their inflammation, but we realized that people had Lyme disease, and when we got to that point, we were often stuck. We hadn't had training in Lyme, and we just would send people to other Lyme literate practitioners. I wanted to train with Dr. Tom because actually we had personal experience in our family with Dr. Tom. My grandson, at the age of 4, was diagnosed with chronic Lyme disease, and he had seen other practitioners and he wasn't getting better. My daughter found Dr. Tom. She drove to Connecticut. When she came back, she was full of hope. She told me that, I have to get to know him, and I watched my grandson improve under his care, and with that kind of personal experience, I saw how reasonable he was, and I saw, how he worked with, this 4-year-old child and made him feel comfortable. I just knew that I had to work with him so I could learn to doctor the way he was doctoring. I knew that we had to learn how to take care of Lyme disease in our practice. There just isn't really any alternative. It's epidemic. It's epidemic here in New Jersey. It's epidemic in many states across the country. I've done other training programs for other things, and the cost of this really, in terms of the value that it gave, was really not that much. And the time investment, when you're learning what you need to learn from Dr. Tom, it doesn't seem like a big investment at all. What surprised me the most about working with Dr. Tom, it seemed like such a huge field, and how he brought it down to a way that you could make sense of that and really have almost like a roadmap to taking care of these people, and it just brought order to the chaos. So since I've done Dr. Tom's program, when I get a Lyme patient now, or somebody who could potentially be Lyme, those people used to scare the bejesus out of me. Now, I have a system. I do the testing. I see what's on the testing. I'm able to put together complex treatment plans. It's almost like chess. You're thinking 2 or 3 or 4 moves ahead, and that's what Dr. Tom's program does for you. What makes Tom's training program unique is that, number one, it's very personalized. He's very available. He answers all your questions almost in real time. And I feel that this program has met all the needs and exceeded the needs that I had. And I would recommend it to anyone because, again, I can take care of complex chronic patients now that have Lyme disease and, all the concomitant morbidities that come with that. I wouldn't have been able to do without this program. Hi, I'm Dr. Vincent Leonti from Lawrenceville, New Jersey.
Before I found Dr. Tom's LDPC training program, I think I was working with chronic illness patients in a much less organized way. So, what made me say yes to Dr. Tom's LDPC training program was two things. I was working with a number of high level professionals who see a lot of people with chronic infections like Lyme, and they told me, wow, yes, Tom is a really solid teacher, a really excellent clinician. I was also really impressed by the promise, which was intensive small group mentoring on a regular basis, as well as just-in-time support for cases and patient management. If there was anything that would have prevented me from getting started with Dr. Tom's LDPC training program, it certainly would have been cost. Once I felt clear that I really did want a new level of expertise, it felt much easier for me to commit to the cost. Over 6 months, I was able to get a very strong foundation in taking care of patients with Lyme disease, the common co-infections, Bartonella and Babesia, as well as frequent related entities. Within the first week of being in this mentorship, I already had a little outline of things that I could use in my practice next week. What surprised me most about Dr. Tom's LDPC training program, I'd say initially, was Tom himself. He's funny, he's very real, and a warm person, and he just makes you feel okay with not knowing everything. And he really uses that personality to create a small group learning environment where you feel safe. I think the other piece that surprised me was the fact that there is a nice camaraderie among the people who do this program together. I felt supported and inspired by Dr. Tom during this program because he really is his own best story. He was sick for a long time before he was able to work with various practitioners and learn why. And he went from being somebody who was doing okay getting by to somebody who was really thriving. And it was really important for me, especially at that point in my career, to see that that was possible. Dr. Tom's LDPC program really did help me build a new level of comfort with my chronically ill patients. What I'm doing differently now that I've completed the LDPC training program is I've really broadened my toolbox, and I am much more open-minded and intentional about layering things together. I feel much more comfortable now combining different modalities, advising my patients about things that are more high level that may be appropriate for them. There's actually many possible roads to wellness, and I think I appreciate the breadth of those possibilities a lot more since being in this program. What makes Dr. Tom's LDPC program different from what I've done in the past is the level of one-to-one mentorship that is available. For another practitioner who may be on the fence about Dr. Tom's LDPC training program, I would say that you will definitely get a lot out of this program if you're ready to put something into it. I will give a shout out to Tom for creating this because there are so many people who are confused about how to treat entities like tick-borne infection and mold. I am Jessica Montalvo. I am a physician trained originally in internal medicine and palliative care, and now really in the integrative and functional medicine space. And I am based in Chicago, Illinois.
Hey everybody, it's Dr. Darren Ingalls here, and I want to talk to you a little bit today about the power of mentorship. You know, when I was a medical student, I remember part of my training is I had to go work in another doctor's office, and we had to spend 100+ hours working with doctors in clinical practice. And what I really valued out of that is I got a chance to see what it's like to get, 10, 20 years of experience with that doctor and those clinical pearls that they just acquired over the course of having practiced for so long. And I learned so much as part of that process. I feel like sometimes even more than I was actually learning in medical school, because I had that one-on-one ability to sit down with that doctor, pick their brain, find out what worked. There's so much power in that because, again, you can consolidate someone's years of experience into a very short period of time. Well, that's what my friend Dr. Tom Moorcroft is doing here for you guys. In his Lyme mentorship program, he's taking over a decade of experience and consolidating that down for you. So that in a matter of dozens of hours, you're going to get the benefit of learning everything he's acquired from clinical practice, going to lots of conferences. Look, I go to a lot of conferences too, and I see Tom at all these there as well. So I know that you're getting a lot of clinical experience, a lot of the benefits of getting everything he's learned in his practice, and he's going to be able to apply that to what you can use in your practice. So I know in the mentorship program, you're going to get a lot of beneficial material. You're going to get weekly calls. You're going to get a private community where you can post questions. You're going to get virtual office hours where you can bring your tough cases to him and he'll be able to sit down with you and talk you through how to manage the case. I think it's the one thing we all struggle with. If we're healthcare providers, we go to conferences, we learn this great material, and you're like, great. And you start a patient on a protocol, and what if it's not working? What if it backfires? Now what? Well, they didn't tell me about that in the conference I went to. Patient management in Lyme disease and tick-borne illness is critically important. And I think this is where a lot of practitioners fail, is they just don't know what to do next if a patient's not responding the way you want. So patient management is really the key to being successful in managing these very complex patients. And that's where you're going to get out of Dr. Moorcroft's mentorship. You're going to get that hand-holding. You're going to get that process of thinking through a case, and he's going to share with you his thought process. You'll be able to figure out how it best works for you. But again, you're going to take that his decade plus of experience and be able to consolidate it in a very short period of time. So I strongly urge you guys to sign up for Dr. Tom's program. I think you're going to learn a lot, and you're going to find that your knowledge of Lyme disease and tick-borne illness just becomes exponential after going through the program. So I hope you guys sign up. I think you're going to find it a exciting, educational program, and I know Dr. Tom has a lot to offer to you. Thank you.
Before working with Dr. Tom's LDPC practitioner training program, I was working with chronically ill patients, mostly seeing them for chronic GI conditions, chronic fatigue, using functional labs to diagnose those conditions, and then treating them with various protocols related to herbs and nutrient imbalances and overgrowth in the gut, as well as other environmental exposures that they may have experienced. I said yes to Dr. Tom's LDPC training program because not only is he renowned in his field and has a lot of clinical experience, I was also looking for a really structured program that could give me real life protocols to follow for my patients so that I could have that guidance. And also, it was nice to have some of that one-on-one and group support with patient cases and to be able to bring that back to the group as a collective whole to really kind of get that guidance. If there's anything about Dr. Tom's training program that might have prevented me from getting started, it would have been the time commitment piece. As a mom, a professional trying to advance my career, spending a lot of hours seeing patients as well as some of the other commitments, that was the biggest concern for me. What surprised me the most about Dr. Tom's LDPC training program was probably the community that it created with having a bunch of different practitioners from a bunch of different backgrounds and fields and coming together to support each other, and also a lot of the featured speakers that Dr. Tom brought in. I felt supported by not only Dr. Tom, but also the group. Anytime we had patient cases that we wanted to present, he was really very open in hearing them and kind of helping to run through the differentials and run through the case study itself. So that was really nice to kind of have that level of support by the owner of the practitioner training program. That's not always the case. Going through the training program helped me feel a lot more comfortable treating my chronic illness patients, especially those with tick-borne disease and Lyme disease. That was really what I was looking for from this program, was some direction, some critical thinking skills. What sets Dr. Tom's LDPC practitioner training program apart from other training programs, and I've done a lot of them, I think is the structured nature of it and some of the real world utility, some of the real world information about specific cases, how to handle those cases, a lot of the didactic, that sort of happens regularly in practitioner training programs. But being able to have one-on-one mentorship and group mentorship, as well as being able to talk about cases, I think is, probably the most valuable piece of this particular training program. If you're on the fence about attending Dr. Tom's training program, I would tell you this. If you want to advance your career in functional medicine or managing chronic illness, this is a must. Being able to identify Lyme, tick-borne disease, advanced chronic illness, this is a part of that process. And I will say that you'll continue to get stuck and continue to have to refer your patients to other people until you've done a program like this where you can navigate those symptoms and have a better algorithm about figuring out what the next steps are and feeling confident about what labs to order, how to interpret them, and then how to treat that person for that condition. This is your next step. Tracy O'Shea, Sacramento, California.
Before I found Dr. Tom's LDPC training program, I've been treating chronic illness patients through my experience with ILADS training, mentoring with different doctors, and trying to piecemeal and put everything together that I had learned over 10 years. But I didn't have a good outline or solid foundation to treat these really chronic, complex patients in a clear, concise way. What made me say yes to the LDPC program was the volume of really complex cases that were coming into my office. I just wanted to have more expertise and confidence in being able to treat these patients effectively. I know that Dr. Tom has been treating complex illness for many years, and when I saw that he was offering a course, I said, okay, if there was anything that may have prevented me from starting Dr. Tom's program, it would probably have been the cost. Without a question, it was definitely worth the investment. What surprised me the most about Dr. Tom's LDPC program was the evidence-based medicine and the literature that he used to support all of his teachings. He gave us a great set of resources that I continually turn to and can go over with my patients as to why I am choosing this treatment versus another, and to help patients understand my thinking process. So he has helped me have a thinking process that is more clear and more backed up by evidence-based medicine and research. Dr. Tom's LDPC program really supported me having a broader and wider range of choices, being able to see each person as unique and having this huge toolbox to pull from in which ways I was going to choose to treat that individual patient. And we had opportunities to talk about complex patients as a group and to get feedback from all of the practitioners as to how each one would look at this particular case and what they might choose. So to have that group support as well as to have the foundational knowledge that Tom provides for us is invaluable. Since the LDPC training program, I feel a lot more confident using pharmaceuticals, actually. I have a very comfortable and solid foundation in using herbal products for treating patients with chronic illness, and being able to integrate the pharmaceuticals and feel confident and safe in the choices that I am providing for my patients has expanded the way that I can support the people that come to me. I think overall, I just have a much bigger toolbox to choose from. What differs LDPC training program from many trainings that I have done in the past was the structure of this training program. It's not a long weekend where you're flooded and bombarded with a ton of information that you eventually just don't have time to process through and end up not using. This is done over a year or 2 years, and you have time to integrate and process the information and use it slowly. And then as you're using it, you're coming up with more questions that you can present to the group, implementing what you're learning as you're learning it, and not feeling overwhelmed because it's too much information that you've learned in too short of a period of time. For any practitioners that are on the fence for joining Dr. Tom's LDPC program, I would say just jump in. We desperately need more practitioners that are trained and well-versed in how to treat. And Dr. Tom's program will provide you a solid foundation. I am Sean Tepper-Levine, and I live in Kingston, New Jersey.